So welcome, everyone. I'm delighted that you joined us for today's MTI Research Snaps webinar, exploring the use of public transportation among older adults during the COVID-19 pandemic. This webinar is the first in our Advancing Transportation Equity series, which explores transforming equity in transportation as we reflect on some of the most pressing issues of diversity and accessibility in the industry as a whole and how we overcome them. My name is Dr. Hilary Nixon, and I am the Deputy Executive Director of the Mineta Transportation Institute at San Jose State University. MTI leads 3 multi-university competitively selected consortium: the Mineta Consortium for Transportation Mobility, funded by the U.S. Department of Transportation; the California State University Transportation Consortium, funded by the Road Repair and Accountability Act of 2017, otherwise known as California's Senate Bill 1, and the Climate Change and Extreme Events Training and Research Program, funded by the Federal Railroad Administration. MTI's mission is to increase mobility for all by improving the safety, efficiency, accessibility, and convenience of our nation's transportation system. As you will learn in today's webinar, millions of older adults rely on public transportation in their daily lives. But adults age 65 or older often face additional challenges accessing and using public transportation. And this population encountered even more barriers during the COVID-19 pandemic. This research explores how older adults living in major metropolitan cities in the US used and perceived public transportation during the pandemic. We will also learn about how this study's findings may help transit agencies develop effective strategies for meeting older adults' transportation needs. Our speaker today is MTI Research Associate, Dr. Etsu, who is also an Assistant Professor of Business Analytics at San Jose State University. His research interests center on the development of use-inspired machine learning models to solve challenging business problems in healthcare, manufacturing, and transportation. During the webinar, if you have any questions for our presenter, you can submit them through the chat or Q&A feature. We are recording this webinar, and the link to view will be available shortly on our website and social media pages. Thank you so much for taking the time to be here today. Dr. Etsu, I give you the floor.
Thank you, Hilary, and thank you for the introduction. So I'll just go ahead and share my screen. Please let me know when you're able to see it.
It looks great.
All right, good. Thank you. So good afternoon, everyone, and thank you for being here. So just like Dr. Hilary mentioned, my talk for today, it's titled Exploring the Use of Public Transportation Among Older Adults During the COVID-19 Pandemic. So this is a national survey. So here's the agenda for today's talk. I'll go through a little bit of the introduction, all the way to some of the limitations we encountered while performing the study. As you can see from figure 1, it's showing population projections for different age groups, right, from 1950 to 2100, right, but specifically focusing on the pink line, which represents older adult group. And according to the United Nations, this group is basically one of the fastest growing age group worldwide, right? But with a focus on the US, and according to the US Census Bureau, it's also the fastest growing group in the United States, right? And by 2030, the Census Bureau is looking at this population making up to 21% of the entire US population. You know, with age comes some challenges and some declines, right? So what we have done here is to classify those declines into 3, right? Which is perceptual, cognitive, and physical declines that are common when we start aging, right? Examples of this include reductions in vision and hearing, diminished attention and memory capacity, as well as loss of motor or control. And then as a continuation to this, to combat some of these challenges or losses as we go older, older adults may need to be active and engage in physical, mental, and social activities. And over the years, research has shown that this area has been growing with different types of activity. For example, one of the studies published by my co-author in 2021 found that older adults engage in more aerobic exercise, reviewed better task performance than those who did not have regular physical exercise. So it's possible that for an older adult in their 70s, they tend to have better cognitive and physical functioning, right, than other individuals in their 60s who do not perform regular physical exercise. So older adults have needs, right? And there's so many of them. But one activity that contains all the physical, cognitive, and social elements that older adults need has not been thoroughly studied in literature, and that element is mobility, right? Mobility, as in travel, is a situation where individual travels in or within their community, and is an essential element in the life of older adults, right? Pre-pandemic, it was common for this demographic to try to stay active in their community as possible, right? Being mentally and socially engaged, as well as being physically engaged. And that has shown that it's very important to age well, according to the National Institute of Aging. So, for example, taking the bus to a pharmacy, right, involves an individual planning the route, right? And that takes a lot of cognitive workload, right? You have the physical exertion, maybe walking from your home to the bus stop and so on. And then the social interaction, which might be talking to the bus driver, or even talking to people on the bus, or even the pharmacist when they get there. So by maintaining mobility and independence, older adults could lower their risks of developing cognitive diseases, such as depression or dementia. So having looked at some of this, we identified our first gap in literature, which is right now it was unclear how older adults maintain mobility and engagement in cognitive, physical, and social activities during the pandemic. One possible solution to helping them maintain mobility is using public transportation, right? This solution is essential for people who no longer drive due to age, right? Or cannot even afford personal vehicles or taxis. So I am here in California, in the San Francisco Bay Area, and public transportation is kind of it's taken the leading role in facilitating mobility needs, not only for older adults, but for other age groups, right? But for older adults, it helps them to connect with their friends, their families, as well as help connect them to essential services within their community. However, here in the Bay Area, we have 25 different transportation agencies and many methods of transportation, which can sometimes be overwhelming and confusing, right? Compounding this complexity, many transportation routes were either removed or closed as a result of the COVID-19 pandemic to try to reduce or prevent the spread of the virus, and also preserve the flagging funds of the public transportation system. Furthermore, despite the possibility of making public transportation more accessible, and then we had things like smartphone apps such as the Clipper or the BAT, which stands for the Bay Area Rapid Transit. All those things can make consumers more hesitant to adopt this technology, especially for older adults. So we had a combination of factors, right? Or we see a combination of factors such as transaction complexity, lack of security, and poor design, right, can make people reluctant to fully adopt this technology. But older adults who generally have a slower pace in adopting new technology may be further impacted by the usability and accessibility of this mobile technology, and thus influence their mobility. So our next two research gaps kind of centered on how transportation technologies might impact the use of public transit systems by older adults. So gap 2 is if these technology applications were used by older adults in general, or were they used during the COVID-19 pandemic? And the third gap centered on whether these technology applications were accessible to older adults during the pandemic. And here we have our goals of the study. So we looked at 3 different goals, or would I say objectives for our study. The first was to explore the impact of COVID-19 on older adults' mobility. The second was to explore the impact of COVID-19 on their daily activity. And finally, to explore how older adults currently use mobile apps to facilitate their mobility within their respective communities. So in the method section, we used a survey approach in order to collect data from the respondents. So our survey was composed of 124 questions that were basically categorized into different sections, such as demographics, COVID-19, public transportation, mobile technology, and so on. And then you could see the different sources over here on the right-hand side where these questions were adapted from. And then in terms of the inclusion criteria, we used Qualtrics to develop the survey, and it was hosted on the Amazon Mechanical Turk platform, which is a survey hosting platform. And we had some inclusion criteria, right? They had to be age 55 or older. They had to have used public transportation at least once during the pandemic. And then looking at the participants we got, we received 260 participants over the time frame we had the survey active. And then 45% of those participants were female, right? And just 4%, or should I say 4.6%, were African American, with majority of the respondents being Caucasians at 93%. An average age of 60 years, and 84% were still working, as well as 41% had an annual income between $50,000 to $100,000. So figure 2 shows us the very first results we received from the survey, which centered on the forms of transportation that older adults used during the pandemic. So 76% of the respondents reported that their travel patterns changed as a result of the pandemic. And then 26% did use public transportation at least 3 or more times per week. 53% drove themselves in their personal vehicles, and then 42% took the option of walking 1 to 2 times a week. And then in terms of the reasons, right, why did they want to use public transportation? Our top of the list in terms of the reasons were medical appointments and then going to work, right? And very few of them used public transportation for recreational purposes. The next thing we looked at were what were some of the barriers or challenges that these respondents were facing when it came to using public transportation. And we found that more than half of the respondents experienced challenges during like finding public transportation, which amounted to 51% of them. So investigating further into that 51%, we discovered that 32% reported major problems with service reliability, 36% reported expensive fares, 21% reported that public transit service was not provided either where they were living or where they wanted to go to. The other thing we did, which is very unique in our survey, which also adds to literature, was the fact that public transit is also used by disabled people. And some of the respondents in our survey were identified as disabled people. So we looked at how what barriers they had with regards to paratransit, and 29.23% of the respondents kind of answered the questions. And we saw that they had some similar responses to those people who were not disabled. And as you can see, 20% of the respondents had a major problem with the fact that service did not operate at the times they needed it. And then in terms of COVID-19 concern, obviously we saw the news during the early stages of the pandemic, and the older adult age group were one of the most affected, right? And most commuters or most of the respondents were stressed and worried about contracting COVID-19 due to physical contact while on the public transit system, maybe buses or trains, right? And the majority of them, around 52%, were apprehensive about contracting the virus if they sat down close to a passenger who was sneezing or coughing. And then for each category, as you can see from figure 6, over half of our participants were at the very least, right, very concerned about getting COVID, right, from their fellow riders. And then in terms of smartphone usage, to see how they used mobile technology to get public transport. Respondents were asked questions designed to assess whether they could easily and confidently use mobile transit applications. And we found that 73% of the respondents believed that any mobile transit application would enable them to quickly obtain transit information. And then we also looked at the cognitive and physical activities, which the results are displayed here on figure 8. And we discovered that 40% of the respondents reported engaging in multiple exercises, right, such as jogging, cycling, or swimming several times per week. And then also 47 of the respondents cited walking as their preferred exercise for keeping fit physically, right? And then also another, this was kind of unique for us because 10% of the older adult respondents aged 65 and above did not engage in any cognitive activity, which was very interesting for us to see. During the pandemic, they did not engage in any activity. So just to summarize what our work was aimed to do, we looked at exploring older adults' use of public transportation during the COVID-19 pandemic. And some of the finding was older adults were concerned about getting infected with COVID. Also, most of them changed their travel patterns, as well as experienced different challenges associated with public transit. And then the top 3 purposes why they use public transportation was for medical appointments, for work, as well as visiting family, right? So 22% of our respondents still kind of dependent on their family or friends to get transportation related information, right? And then we discovered that 67% of those that had access to smartphones were able to look for their transportation information by themselves. And that group kind of reported very low challenges with using public transportation. So, and all of this was consistent with what we had found in literature. And then to kind of round up with the limitations, we did have some limitations. I think one of them was looking at the ethnicity, having a lot of Caucasian respondents compared to the other groups. And this is the team, the students, as well as my co-PI. Thank you for joining and listening to the presentation today. Thank you.
Great. Thank you, Dr. Itu. Such compelling findings, really interesting work. Once again, I want to invite our guests to please submit any questions using the Q&A feature or chat. But there were some questions that were submitted earlier. So I thought I'd want to start with those. And I think, you know, when we think about making transit accessible and efficient for older adults, what do you think is the most important takeaway from your research?
I think for I and my team, the most important takeaway would be how to incorporate or create more awareness with technology, right? And how older adults can utilize this technology to make the aspect of mobility in their lives pretty easy and efficient, right? Because just like how you saw on my summary slide, 67% of older adults who had smartphones or access to technology were able to utilize it to get transportation information. So that ranged from routes, prices for the trains, or when the bus was going to come, and all those different things. And that helped reduce some of the challenges they were going to experience or face if they did not have readily available information. So
great. Thank you for that. So we did have a question submitted, and I might have you go back through the timing of when you did this survey, because the question asks, since the pandemic restrictions have eased and there's been more people going out and things like that, do you know if there has been an increase in transit ridership among older adults? And I'm not sure if your study would have covered that, but even if it didn't, if it's been something that you have been following in the news and in the literature.
Okay. No, I haven't followed that yet recently, since after we completed our study, but our study period was from April to May 2021, right? So that was our study period. And then,
Okay.
April to May 2022. And then the other, we're currently looking at redoing the survey again, now that some of those pandemic restrictions have eased, to see what opinions we would now get from older adults. So, yeah.
Great. Thank you for that. So there's another question that was submitted. And again, folks, if you've got questions, feel free to either put them into the chat or into the Q&A. So there's a question from an audience member asking if your research looked at all about a shift from riding the bus to taking paratransit services, if that was covered in your survey.
No, we did not look at why that shift was there, right? So as part of our questionnaires, we just kind of included, we wanted to see what the opinions of people with disabilities would be, right? And we know they tend to take paratransit services, right? I mean, people on wheelchair and stuff like that. So we just wanted to include that section that covered paratransit service in order to be able to capture their opinions. So
great. Thank you. There's actually a question here from an audience member that I was thinking of as you were giving your presentation. And so you gave us collectively some of the information about older adults, but I'm wondering if you looked and, for example, divided the survey up. So looked at responses from younger seniors, so those, let's say, age 55 to 65, versus older seniors, let's say 75 and above, and saw different responses in terms of how you looked at that analysis. For example, on the question of mobile app usage or interest.
So we haven't looked at that, but I think that is something that I would definitely take down and go back and look at the data in terms of the mobile app usage when you split it for younger and older seniors. So
yeah, and I think similarly, so there's a question, and I think you already acknowledged some of the limitations with the sampling approach through MTurk, and you didn't get as diverse a sample size as you were hoping. Did you also look, for example, at lower income, how their travel behaviors might have changed and things like that? Because I could imagine that the sample size, as one of our audience member noted, the sample size was probably skewed in that area as well.
Yes. So because of that, we did not look at focusing on that very small area because of the skewed sample size. And that's why we're now preparing a second survey as a follow-up, and we're going to utilize a different tool. So instead of using the Amazon MTalk, which we saw different limitations with it, we're now working with Qualtrics, which has a better survey platform. And that way, we would be able to get a good number of responses from Qualtrics. In fact, way more than the 260 participants, which we got. And then the other thing we're looking at is to address we also had a limitation with the age. So MTalk only allowed us to look at 55 and above instead of the conventional 65. So for Qualtrics, we're going to be starting from 65 and above. So
great. Thank you for that. So, and a question from the audience. So, based on findings, when you think about what you learned from this study, what do you think about recommendations on how to address some of these obstacles that you encountered that older adults face? Do you have recommendations for what a transit agency or community could do in terms of a pilot program? Are there policy changes? What do you think are some of the recommendations to address some of these challenges and barriers?
Yeah, thank you for that question. I think it's a really good one as well. We did look at the National Aging and Disability Transportation Center to see how we could develop some recommendations to help older adults, right, during this period. And one of them would be assisted transportation, right, because that would literally solve a lot of the barriers that older adults were facing during the pandemic. So an example of the assisted transportation would be a door-to-door, right, assisted transportation, or even having somebody maybe go into their houses when they need transportation and basically maybe taking them or being with them all through their transit journey. That way, they're able to address all those different challenges or barriers which they let us know they face during public transportation. So I would say one of them is the assisted transportation, which is a recommendation we would give.
Great. What I've really appreciated from this is you've kind of addressed some of the things that you want to do next, and how to look now more in terms of what's happening today, some of the changes in terms of the methods, those kind of situations. And I think there's been a couple of other suggestions, for example, looking at multi-generational households and things like that, and also kind of thinking about in terms of solutions and challenges that might work into the questions, thinking about things like, does the urban environment, the built environment in and around where these individuals live, influence the kind of services and the types of transit options that they have available? I know that there are some questions that we are not going to get to. So for that, I apologize to folks. But what I've seen through a lot of them is some really great suggestions for what I think Dr. Edu can do moving forward with the next phase in this research. And wrapping up, because I want to make sure that we are being respectful of everyone's time and finishing up within our 30 minutes. I certainly want to thank you, Dr. Itu, for joining us today. For those of you who did not see in the chat, the final report has been published. It's available on the MTI website if you would like to take a closer look. And I am sure that Dr. Itu would be more than welcome, more than happy to follow up with any of you on suggestions for the next phase in this work. So one last note before we go. So please do join us next week on February 14th at 1:30 p.m. for the second webinar, 1:30 p.m. Pacific. I realize we've got folks from across the country joining us. So 1:30 p.m. Pacific for our next webinar in the Advancing Transportation Equity series called the Central Valley Transportation Challenge. And the Central Valley Transportation Challenge is a project-based learning program that brings university faculty and students to K-12 classrooms in rural areas. So please join us to learn more about how this program empowered underserved students and how this model and its hub can continue making a positive impact in transportation. Thank you all again so very much. And thank you for all of the great comments and questions. We really, really appreciate it. And I look forward to seeing you at a future webinar.
Thank you.